So hello everyone, hello dear colleagues. We are going now to discuss the role of dietary protein in the maintenance of bone health. First of all, these are my disclosure. Now, if we look at the natural history of the fracture, as you know, there are two main determinants. The first one is a mechanical overload due to the falls. And the second one is mechanical incompetence, bone fragility, such as osteoporosis. And there are several determinants as well: bone mass, geometry, microstructure, and material level properties. Then when a fracture has occurred, our friend orthopedic surgeons are taking care of it. And then we have the process of rehabilitation to restore independence, to reduce disabilities. And then the program will end up with the prevention of subsequent fracture, particularly in the frame of the capture of the fracture program, which has been set up by the International Osteoporosis Foundation. And with the aging of the population, the problem is getting worse and worse. Since last year, we had more than close to 9 million more fracture annually. And the issue now is the role of protein malnutrition in this different process. For the mechanical overload, this has been reviewed by the previous speaker, but now let's see the different step. First of all, next slide, please. We know that the patient, particularly with a hip fracture, are malnourished. And depending on the test you're applying, it could be as low as 18% or as high as 50%. And we know that malnutrition is associated with an increase in mortality and a very poor outcome after the fracture. And this mortality is very high during the first year, amounting to 30% and even 40% after 3 years. And this indicates that early nutritional assessment is mandatory to detect a patient at high risk of malnutrition to introduce the right preventive measure. But in addition to protein malnutrition, we know that the patient with a hip fracture particularly are severely vitamin D deficient. And in one paper in Spain, it has been shown that more than 3/4 of the patient have a level of 25-hydroxyvitamin D below 50 nanomole per liter. Now the issue is, next slide please, how much is protein malnutrition associated with a fracture? And you see here in the 15-year follow-up in a large cohort in Canada that if you look at the left side of the curve, the lower the protein intake, the higher the risk, with a twofold risk at a 10% protein of total energy intake. And this is approximately 0.6 grams per kilogram of body weight. And we know that most of the patients, men and women with a hip fracture, have protein intake close to this 0.6 grams per kilogram of body weight. And we know that in adults, the recommended dietary allowance is 0.8, and we will see later that in the elderly, probably a higher amount can be recommended. Now, in terms of a mechanism, what could we infer relating bone fragility to the dietary protein intake? And in this study, we measured the failure load, which is an estimation of bone fragility. This integrates the geometry of the bone as well as the microstructure. And what you can see here, when the dietary intake was divided into tertiles, those patients in the lower tertile had significantly lower bone strength, failure load, so you needed less Newton to break the bone as compared with those is a higher tertile. And this is true with animal proteins, dairy proteins, animal non-dairy proteins. And this picture has been confirmed in another population of the elderly in Canada, men, with exactly the same data. And in both studies, it was not possible to see any relationship with protein of vegetable origin. Next slide, please. So we know that the low protein intake is contributing to mechanical competence and the occurrence of the fracture. Now the next question is, what about protein malnutrition and fracture repair and rehabilitation? Next slide. For fracture repair, as you know, it's very difficult to follow up the patient and determine the rate of fracture repair. So we have to rely on a animal study. So in this study, rats had a titanium implant within the proximal tibia. And you can measure here mainly two things. The first one, the strength to pull out the implant. And then you can see the macrostructure, how much the implant was integrated within the bone. And what you can see here, when the rat received a normal protein diet in black, there was a higher strength required to pull out the implant, while those rats with a low protein intake, so reminiscent of the patient with protein malnutrition, you needed less strength to pull out the implant. Now, next slide is, what about if we give back some protein to the patient with a hip fracture? And this is a randomized double-blind trial in patient with a recent hip fracture, and everybody received some calcium, everybody received some vitamin D, and then there was a supplement of 20 grams of protein. And what you can see here, there was a higher increase in IGF-1 in the supplemented, and there was some attenuation of the loss of bone mineral density at the femoral neck, FN level. And this was associated with an improvement in the outcome, since the stay in the rehabilitation ward was reduced by 33% in those patients receiving the protein supplements. Next slide. And this type of results with other have been integrated in a meta-analysis by the Cochrane company. And what you can see here in blue are depicted the value which are significant on a statistical point of view. So the complication, pressure sore, infection, also anemia, was reduced by 29% in those patients receiving some protein supplements. And when you combine this complication with the death rate, it was reduced by 33%, indicating that if you give some protein supplement following a hip fracture, you have a better outcome. And this was well supported, since if you look at the GI side effect, it was not higher as compared with the placebo group. Next slide, please. So this led to the ESPEN guidelines, and they said in recommendation 43, all the patients with a hip fracture shall be offered oral nutritional supplements after the operation in order to improve dietary intake and reduce the risk of complication. And this was considered as the recommendation of grade A, so the strongest quality in terms of recommendation. Next slide, please. Now, if we move to the prevention of subsequent fracture, next slide, we know that if you compare in observational studies, because at the present time, we do not have randomized control intervention studies with the fracture as the main outcome. But what you can see here in this meta-analysis, that the risk of hip fracture was reduced in those patients belonging to the highest category in terms of protein intake, and even if it was above the current recommended dietary allowance. So this altogether was associated with a 16% reduction in the risk of hip fracture. And the question could be, what type of protein? And we know that the main source of protein are certainly the fish and meat, but we have a lot of protein and calcium as well in the dairy products. And the question has arose, what is the association between the risk of hip fracture and dairy product consumption. And over the last few years, there are at least 5 different meta-analyses with different conditions of inclusion, explaining why in sometimes you have 10 cohorts, sometimes 14 cohorts included. But what you can see on this slide, which is a summary of the different meta-analyses, in blue with an asterisk, those values which are significant different from one. So this means that particularly for fermented dairy products like yogurt and cheese, there was a reduction in the risk of hip fracture in those patients consuming dairy products, and particularly fermented dairy products. And in terms of mechanism, next slide, this is a long-term follow-up in 65 years healthy women. And these women were divided into those in black having less than 1 yogurt a week, and those with at least 1 yogurt a day, and this is the open column. And what you can see here when you look at the evolution over time of the CT area, cortical area, CT VBMD, so the cortical volumetric bone mineral density, or the trabecular area, or the total volumetric bone mineral density, those subjects with a very low intake of yogurt were losing bone much more than those with a daily intake of yogurt. Now, we could ask the question, what about the safety of this protein? And you have heard about the theory that some protein, particularly those containing sulfur amino acid, could be metabolized into some proton, and this proton could reduce the pH and dissolve the bone. So we ask the question, what about in the general population of men and women, healthy, 65 years old, followed for 6 years, what was the association between a diet of different acidity? And you see here in this cohort, there was 59% with a so-called alkaline diet, 18% in the so-called acidic diet, and this was determined by the measurement of the potential renal acid load, PRAL. And what you can see on this slide, irrespective of the type of bone, the variable, radius total BMD, radius cortical BMD, and so on, there was a decrease over time, as expected with the aging of the cohort, but there was not a higher loss in those patients with a so-called acidic diet. If anything, it was even lower. And this was true in the gray column in women and true in the men column in dark, indicating that at least in this cohort of healthy individual with a balanced diet, there was no effect of the type of the acidic or alkaline diet. And this has been shown not only on bone mineral density, but also when you look at the fracture. And this is a large cohort, 9-year follow-up with a 7-day food record, the dairy. And you can see here that the prevalence of osteoporosis or the prevalence of fracture was not influenced by the acidity of the diet, evaluated by the NEAP, so the net endogenous acid production, or the PRAL, the potential renal acid load, and this in patients with renal failure, CKD, or with patients having a preserved renal function. So in conclusion, next slide, we could also ask the question, what about other safety? And we know that dairy products, particularly some meat as well, have been considered as providing a lot of fatty acid, which could be deleterious on the cardiovascular system. And on this long-term follow-up, and this has been confirmed in several meta-analyses, it appears that the protein from dairy source or the total dairy intake was not associated with an increased mortality, was not associated with a major cardiovascular disease incidence. If anything, it was even slightly lower. And this lower risk was even detected in those with a low intake, as you see on the bottom of the slide. So, ladies and gentlemen, dear colleagues, next slide, please. What are the recommendations to maintain bone health? First of all, an optimal dietary protein intake, particularly the oldest old, should amount to 1 to 1.2, even 1.3 gram per kilogram of body weight per day. And to achieve that, the best is to have the protein intake spread out of 3 meals, with each meal 20 to 25 grams of high quality protein. And in addition, vitamin D is recommended between 800 units to 1,000 units, with a calcium intake of approximately 1,000 milligrams per day. And obviously, we need some physical activity 3 to 5 times a week, combined with a protein intake, which should be ingested in close relationship with exercise. So what now are the take-home message? The rate of bone protein energy malnutrition in acute hip fracture is very high. So it's between up to 80% of the patient coming to the hospital with a hip fracture are protein malnourished. And to fight against that, we have the possibility of a balanced diet, including some dairy products, 2 to 3 servings a day, calcium, vitamin D, and finally, fruit and vegetables. And these are the recommendations, 5 servings a day. Now, the SKO recommends optimal dietary protein, as you have seen before, 1.2, 1.3 grams per kilogram of body weight, with at least 20 to 25 grams of high-quality protein at each meal, and with adequate vitamin D and calcium. And as you have seen previously, ESPEN recommends, and this is a grade A recommendation, that an oral nutritional supplement should be given after the surgery to improve dietary intake and reduce the risk of complication of patients with a hip fracture. And with that, I thank you very much for your attention.